A new analysis of insurance claims in Colorado shows a trend among young people, mental health issues. In fact, 1 out of every 4 emergency visits in Colorado between 2016 and 2018 for reasons of mental health was for children under 18. That's just emergency visits. Joining us to talk about it right here is Dr. Brian Morgan. He is a psychiatrist at the Medical Center of Aurora Behavioral Health and Wellness. Thanks for joining us this morning.
Thank you.
There's so much to talk about here, and there's so much to learn. With so many young people showing up at emergency rooms, I guess my first question is that evidence of us reaching crisis stages when they might get help earlier?
It's a good indication that they're getting the help through the ED, but I think what's more important is that trying to reach the kiddos before they get to the emergency department. HCA does a really good job of having its own 24-hour crisis hotline that any family member or kiddo can call. They opened up 2 years ago a adolescent unit there at the hospital in Potomac in order to take kids as young as 5 to get them into group therapy, family therapy, and then actually this year we opened up an outpatient facility to help provide more outpatient services to the community at this time.
Yeah, because you don't want to reach the emergency department, of course. It results in all age groups. In a recent study, I understand it was done by the Center on Improving Value in Healthcare, shows the diagnoses are often anxiety disorders, major depressive disorder, and panic disorders. Major depressive disorder was tops for children. Why is that?
Major depressive disorder is a very heritable disorder. It's more than likely that there is someone in the family, the immediate family, that could possibly also be suffering from major depressive disorder, anxiety disorder, panic disorder. Usually in kiddos it presents as irritability, depressed mood, isolation, and these are kind of like the red flags that we would tell parents to be on the lookout for. The recent uptick in the diagnosis of kiddos, I don't want to go out on a limb and say specifically if it's one thing or another, but it could just be the fact that healthcare providers are getting better at screening for these disorders when children are coming for their primary care appointments. And at that point, it's our job as psychiatrists, insurance companies, and that primary care team to refer them to our care in order to get to them before it becomes an emergency.
Is there something about our society now that has changed this, though, the dynamic between children and the likelihood of mental health issues? I mean, I could pick it up and I could always say, our devices to blame. What's going on with us?
Well, I think it all comes down to better reporting, better know-all of what to look for, what primary cares, what pediatricians are looking for in these children when they're presenting to the office. Back in the day, when you go to your father and say, "Hey, Dad, I got a sore muscle," you say, "Rub some dirt on it. It's just growing pains." A lot of parents are, I've heard excuses of, is it just their hormones? Is it this? Is it that? Is it social media? No, when it comes down to it, we have to take into all the factors of the child's life, family dynamics, school dynamics, what's going on outside of the school, to paint a really good picture of what's going on in that child's life at that time.
All right, Dr. Brian Morgan, I appreciate it very much. Thank you for coming in.
So much.
And there is help out there. Remember, he mentioned there is that line, line you can call at all times.
Colorado Crisis Hotline, and then our HCAT team is available 24/7 up at the Medical Center of Aurora North off of Potomac and 6th Avenue.
Yeah, don't forget it, because it is important for mental health concerns in children and adults. Of course, talk to your doctor. Have that discussion. We have resources at cbsdenver.com. Britt?
Thank you so much. A great interview for us this morning. And